Hi, welcome to today's video. In this video, we are going to be talking about how to write a SOAP note for your progress notes. And we also are going to be talking about how this translates to AI-based technology when using those different platforms to complete progress notes. So why don't we get started? First things first, my name is Lauren Malika. I am a marriage and family therapist out of the Chicagoland area, and I specialize in trauma and attachment. So in this video, we are going to get into just some basics. This video is probably more geared towards newer therapists or therapists who just need a quick refresher on what a SOAP note includes and doesn't include. So first things first is the word SOAP, right? So what does that stand for? So S is subjective, O is objective, A is assessment, and P is plan. So let me give you an example of what each of these may look like and a little definition after each one. So when we say subjective, what we're talking about here is whatever experience is brought up or shared by your client in session that can't be measured and is truly their experience. So for example, something that might be subjective is how they feel like they've been doing since last session, or an increase or decrease in depressive symptoms. So unless you are having them fill out an assessment or doing some sort of scale in session, these are more subjective things. The next one is objective. So objective is something that you can add a measurement to, like it's measurable, right? So when we think of something that's objective, that might look like how many times someone used a coping skill in between sessions, or how many days a certain coping skill was helpful when reducing anxiety symptoms. That would be more of the objective. The next piece is assessment. So assessment is really where you're pulling and you're gathering that data and assessing if they are improving or if they're not improving, or if a different coping skill needs to be put in place, or if there's just something that you're noticing that you feel like you want to keep an eye on for future sessions. That's what the assessment section is for. Lastly is plan. So for the plan section, what we're doing here is we are giving instructions that we would be giving to our clients. So increase using coping skills, or continue current treatment plan, or, if they bring up in session that they're having an issue with their partner, suggesting couples therapy and that being part of the plan. That's what fits into that plan section. Okay, so now let's move on to an example with a fake client named Lucy, okay? So let's say Lucy is a client of mine. I've seen her a couple times, and the reason that she's coming in is because she's been having panic attacks related to going to work, and it's really been getting in the way of her showing up and being productive at work, all of those things. So if I'm in a session with Lucy and the content of the session entails that she comes in, I'm writing out all the basics at first, right? Of, date, time. When I go to the S, so subjective, that would be what Lucy comes in and reports to me. So let's say she comes in and she's saying, hey, Lauren, I had a really great week last week. I was able to use my coping skills that you taught me, some mindfulness skills, and I'm finding that I don't need to use them every day anymore. So I feel like that's a really good sign. So in the subjective section, I would write client reports experiencing a decrease in anxiety symptoms when utilizing mindfulness skills, right? So then the next section is objective. So objective is the part that we can assess. So maybe in this section, I'm saying, compared to last session, I'm noticing a difference in how she's talking. Maybe she's making more eye contact with me, noticing any physical differences and features. I would also put in this section that client reports a reduction in anxiety symptoms when using mindfulness exercises X times a week, whatever that is. So then the next section, what we would say is something along the lines of assessment indicates a reduction in anxiety symptoms and panic attacks by utilizing mindfulness skills on a weekly basis. So then finally is P. So P stands for plan. So what is the plan after this session? So typically with clients, we'll talk about when I plan to see them next, or any sort of differences to their treatment plan or frequency coming in or anything like that. So in the plan section for this client, I might say something like, session is scheduled for next week, client is encouraged to continue using mindfulness-based coping skills on a daily basis as needed, and to keep a diary of symptoms so they can track and see if it's related to the reduction in symptoms. In the plan section, I might also say something like, next session, therapist plans to teach clients some breathing techniques to add to their coping skills toolbox, if you will. And that's it. That's the SOAP note. It's really basic. And I'm sure, as a lot of you know, progress notes really aren't meant to be extensive or detailed because we really want to protect our clients' privacy and all that good HIPAA stuff, right? Now, I wanted to show you guys how this looks if you're using an AI-based progress note platform. So let's switch over to my computer and I will walk you through what that might look like. Okay, so I am going to show you what a SOAP note looks like on an AI-based platform. So the platform that I use is called Mentalic. This is dictation-based, which means that I record my sessions with clients' consent, of course, and it generates progress notes for me. And what's really cool is that you can select what type of template you want. So for this one, I selected that I wanted a SOAP note. So let's go through and see how it did. So at the top, we have the basic information that we need, right? And as we scroll down, you can see all the parts of SOAP. So subjective for the S, objective, assessment, and plan. Awesome. So this was a fake session with a fake client, and we're going to see how it did. So for subjective, we are putting down what was subjective or what was the client's experience or what they reported. So the chief complaint, so the reason why they came in, is the client presented with a history of panic attacks, but reports feeling happier and experiencing fewer panic attacks compared to the previous week. Wonderful. Quote. So you can throw a quote in there for sure. Yeah, I'm feeling happier, and I'm happy to say that I'm having less panic attacks compared to last week. I've only had a couple. Wonderful. Impairments and challenges. The client has experienced impairments in daily functioning due to panic attacks, particularly when driving to work. So it was able to identify how these panic attacks were impairing her functioning. And objective, meaning this is the part that's measurable, right? So an assessment tool that we used to kind of collect that data was a clinical interview. And in the clinical interview, there's a risk assessment. So we're checking in for risks or safety concerns, and there was no indication of risk in the session. Interventions that were used was the therapeutic modality of mindfulness, including meditation and grounding skills. And the psychological interventions used were the therapist acknowledging the client's progress and praising her for using the skills taught in previous sessions. A new breathing skill was planned to be taught in the next session, and the rationale behind that intervention is these interventions were chosen to help the client manage her panic attacks and improve her overall mood. Great. All right, and assessment. So response to treatment. So how does it appear that she's doing in response? So the client reported feeling happier and having fewer panic attacks, indicating a positive response to treatment. So this is an educated guess that we can come up with, is that she is improving based on what she is reporting. Specific examples or instances, the client attributes her improvements to using mindfulness skills daily. So this is something that she had said in session. Challenges to progress, client did not indicate any challenges or barriers in session, so we made sure to indicate that. The next part is plan. So this is all about follow-up, what's happening next, homework. The homework that was given is to continue using mindfulness skills daily. The plan for the future session is the therapist plans to teach the client a new breathing skill in the next session. Plans for continued treatment. The next appointment is confirmed for Tuesday at noon, and sessions will continue on a weekly basis. For coordination of care, client signed a release of information for the therapist to write a note for work, and therapist will provide the client with a note next session. So in this fake scenario, it would be Lucy saying, hey, I've had problems showing up to work. Would you mind writing my boss a note, just confirming that I am in treatment for this, I am getting help for this. So that way she can see this as an action item. And I would say, of course, just need to sign a release of information and write you a brief note for work that will help with that. So yeah, I feel like it did a great job of picking out those pieces. It's clear what she's coming in for. It's clear what can be measured. It's clear what was reported. And it also is clear what happens next, what the plan is. So hopefully this was helpful to kind of see it all written out and broken down and to see it in a AI-based platform, because I know a lot of us are using these now. All right, thank you so much, and I hope you have a great day.